Welcome to this video on the causes of phlegm and mucus. Phlegm and mucus are common respiratory symptoms that can be caused by a variety of factors. In this video, we'll discuss the different causes of phlegm and mucus, so let's get started. Number 1. Respiratory infections. Viral or bacterial infections of the respiratory system, such as the common cold, flu, bronchitis, or pneumonia, can cause excess mucus production. Number 2. Allergies. Allergic reactions to pollen, dust, mold, or pet dander can trigger the production of mucus in the nose and throat. Number 3. Smoking. Smoking can irritate the airways and cause excess mucus production, which can lead to chronic cough and phlegm. Number 4. Asthma. Asthma is a chronic respiratory disease that can cause inflammation and excess mucus production in the airways. Number 5. Gastroesophageal reflux disease (GERD). GERD is a condition in which stomach acid flows back into the esophagus and irritates the lining, causing excess mucus production. Number 6. Chronic obstructive pulmonary disease (COPD). COPD is a progressive lung disease that causes inflammation and excess mucus production in the airways. Number 7. Sinusitis. Sinusitis is an inflammation of the sinuses that can cause congestion, pain, and excess mucus production. Number 8. Dehydration. Dehydration can cause the mucus in the nose and throat to become thick and sticky, making it difficult to clear. Number 9. Environmental irritants. Exposure to air pollution, chemical fumes, or other environmental irritants can cause excess mucus production. Number 10. Certain medications. Some medications, such as ACE inhibitors used to treat high blood pressure, can cause a dry cough and excess mucus production.